and share with you what worked with the employee process and challenges. What we'll do, I'll start by introducing the panel, giving a brief bio of each, and then we'll go about each will speak about their respective program for almost 5 minutes. And along we ask each panelist to send us a couple of questions that they would like to address, that they feel we can inform the audience from that perspective. And then after we finish, we'll ask you if you have any comments or questions to add to that. This will be the procedure. I'll do that.
Bonjour à tous, bonjour, je suis Estelle Bichon, je travaille avec le DCS. Aujourd'hui, nous allons avoir un panel d'écoles STEM d'approche des développements en Ontario qui vont être animés par Sam, je travaille avec la Fondation des maladies du cœur et de la DC. Juste pour vous laisser savoir s'il y en a qui souhaitent suivre les présentations en français, qui peuvent prendre un des casques qui sont sur les tables. Donc, juste avec les casques et choisir le chemin numéro 2 et ça sera avec l'interprétation simultanée.
So I would like to use our panelists, not any order, please raise your hand or mention your name. We start with Margaret Sophia. Margaret is a health skill and communities consultant at Sophia. She is a very former teacher and health and physical education specialist and has been involved in the development and implementation of numerous Sophia resources initiatives, including living school, preschool, programs, health and physical education support for more than 18 years. There are lots more, but I want to give just a brief introduction of each panelist. Our second panelist is Lori Bujeshi. Lori is a health school and communities consultant, is manager of health promotion initiative with the Champlain Cardiovascular Disease Prevention Network. One of the key initiatives under Lori's guidance is the Healthy Schools 2020 program, which has brought together education, health, and community partners on a shared vision and priorities for sustainable, healthy eating school environments. The third panelist is Caroline Tom, and she is a wellness advisor at the York Region District School Board. She is responsible for developing and administering the board wellness strategy. One of her areas of focus is working with the curriculum consultant for healthy schools to support comprehensive school health action plans that target student and staff well-being. Our fourth panelist is Dr. Scott Levendale. Scott is an associate professor and cancer care and research chair of radiation studies in the School of Public Health and Health System at the University of Waterloo. Dr. Levendale is also the principal investigator of COMPASS, which is a 4-year study about youth health behaviors funded by the Canadian Institute of Health Research. It's being conducted and led by researchers at the University of Waterloo in collaboration with researchers at the University of Alberta and the University of Toronto. Yeah, we start with Morgan.
Great. Before I show a video, I'd like to ask you what you think healthy school means to you. When you hear that term healthy school, what does it mean to you? Anybody want to shout anything out? What does healthy school mean to you?
I don't think your mic is on.
Ah? Oh, that was over.
There you go.
Hello? Testing. Hello?
You come with the board.
Okay. So, when you hear the term healthy schools, what does it mean to you? Anyone want to call anything out? Yeah.
Balance.
Balance. What else? Yes.
My teenagers say it means no more French fries.
No, we're yes, we hear that a lot, right? Yes. What else?
Inclusive? Fully inclusive?
Fully inclusive.
Physical exercise.
Physical exercise. Okay, great. The concept healthy schools can be a little challenging to explain sometimes. So Ophia, and I'm with Ophia. How many of you are familiar with Ophia? Okay. So we're all about supporting healthy schools in communities, and our vision is that all children and youth will value and participate in lifelong healthy active living. And so this video was hot off the press. We do have a handout for you with a little bit of information about it. But I'd like you to watch this video, and as you're watching it, think about how we can make a difference in our
our healthy school communities.
By the way, it's available in French and English. We're working hard at Ophia to try to make everything bilingual. Not quite there yet, though. We're waiting for that to come up. How many of you are currently involved in supporting the development of public schools? Great. Okay, well, we're really hoping this panel discussion will be informal and encourage you to ask any questions as we go. I know I don't have a formal speech, and I don't think the rest of us do either, so it's really about what you'd like to hear. We'll share a little bit about what we're doing first.
I'm actually curious to know, are folks here from public health settings? What settings? Public health? Who's here from public health? Anybody here from a school board or an education setting? Okay, great. Any community partnership, NGO? Okay, there's a bit of a mix. Anyone here from the Ottawa area? Do you mind? Okay, great.
Well, the list starts when I look at this plan at the beginning. Well, maybe schools are one of the oldest settings for health promotion. But usually when we come to school, we always are faced with competing priorities. From the school board on one hand and the public health folks on the other hand. And it's very hard to bring that balance in. Everybody looks at it from a different lens. And this maybe we're trying to shed some light how maybe, and I think it's around the motion today, we heard the language about partnership and collaboration, community innovation, and maybe putting that lens on. And now our aim is to make schools hub for health, but also schools are hub for intellectual learning. But and maybe we look at that sometimes separately in each own lens, but maybe we have to maybe unify it and maybe have one lens look at how we implement that going forward. Maybe, but that's why I think we've got today different levels of implementation on the school level. So we're starting with Ophia, which is a provincial mandate to work in schools and communities. Then we move to Champlain, which is a collaborative school boards and community partners to bring up this issue. And then from a school board perspective, York Region have been a little bit up ahead of the back and trying to develop that partnership and engage not only staff and students, but also the community as well. Then we're going to end up with University of Waterloo trying to do innovative research, trying to measure the impact of changes in the school environment. How can this impact not only health, but also I think development and education at the same time. So we're trying to, and we know, it's evident that this is all connected, it's related, but then how we can bring this up to the people who make decisions on the school and public health to make sure that we're on the same page.
I hope that the speakers will address a question that I think is important to this. Whose responsibility is it for healthy schools anyway? That's what I'd like to hear.
Yeah, excellent question.
What sector are you from?
Non-profit, community-based sector.
We'll be sure to address that, Terry Mark. I think we
Thank
all
you.
have thoughts on that. Okay.
Anyone else have any other questions maybe to plant seeds? Because again, I think we've all agreed we're willing, we really want to make this as useful for you as possible. So if anyone else has a burning question, but I think the video is ready, so.
Yeah, let's start with the radio. Sorry about that. We're 10 minutes behind.
No matter where you're from, we all want what's best for our kids. Am I right? When it comes to wanting them to be healthy and happy, we're all on the same page. Growing up in today's world has many opportunities, but also has many challenges. The state of health of our young people influences not only how they perceive themselves, but also how they manage life's ups and downs. So let's look at how our kids are doing. By now, it's common knowledge that compared to their parents' generation, kids are facing greater health risks than ever before. Don't eat enough fruits or vegetables. growing proportion is overweight or obese, 1 in 5 is battling a mental health issue. Our children are at risk of being the first generation to have a shorter life expectancy than their parents. With today's younger generations being faced with so many obstacles, we have to look at how we can work together to make it better. So, let's look at the big picture. It's estimated that Earth is now home to over 7 billion people. 7 billion! We all have a role to play in working with our kids to help them lead healthy, active lives. Since we can all agree on wanting what's best for our kids, what can we do to help them? People from around the world are making healthy schools a priority. It goes by different names in different parts of the world. In Latin America, they use the term health-promoting schools. Journey of good, healthy schools. Even in the United States and Canada, terms vary from coordinated school health to comprehensive school health. But whether it's called healthy schools or something else, the goal is the same. So what is a healthy school? You're probably wondering. Well, a healthy school involves the whole community coming together to share ideas, plan, take action. What we're really talking about is an approach that involves all of us. When this is done, young people will be better equipped to meet the challenges of today and tomorrow. They'll be empowered to make healthy choices and manage the risks they face every day. So it sounds pretty simple, right? And what we're talking about here isn't a one-person show. A healthy school really takes more than just the kids and school staff. It takes a community. You know the old saying, it takes a village to raise a child. Whether you work in recreation, education, public health, local business, or you're a parent or a child, you can do this. Healthy Schools is about empowering kids so their voice can be heard. By engaging kids in leadership opportunities, they'll know from an early age that they can have an impact on themselves, peers, classroom, their school, and their community. Because really, healthy living can't just begin and end around the school day. We have to look at what happens before and after school as well. And you still with me? In order to work towards healthy schools, let's start with the basics. Think of it like building a house. Now, let's start by pouring our foundation. It's important for everyone to understand the issues facing kids in your community. Could be physical activity, healthy eating, mental health, or bullying. A few. Not sure what they are? Talk to people in your area and make kids an important part of this discussion. Now that you've got your foundation, let's put up our walls. By offering quality programs at school that are delivered and supported by community members, we can provide fun, safe programming that meets kids' needs. If increasing physical activity is your priority, you can offer a variety of activities throughout the year to encourage kids to participate and be active. The physical environment also has an impact on kids. For example, healthy eating can be addressed by building a vegetable garden at your school. Then you can start a breakfast or snack program that is free of charge, available to everyone, and offers healthy food choices. Local businesses can get involved by providing access to fresh local food, and students and school staff can get involved by providing fresh vegetables from the school garden. It's obvious offering only healthy foods makes it easier for kids to engage in healthy eating. And they might even bring some of those habits home. When we look at a positive social environment, all kids are informed, engaged, and empowered to be active members in their communities. For example, if tobacco use is an issue, youth can form a group to empower their peers to make informed choices. Utilizing the strengths of other community members supports partnerships. Partnerships allow you to access services and resources in your community. Coordinating something like a walking program, where participants clear local trails and routes, makes them safe and accessible for everyone. Getting support from community partners like seniors groups involves the whole community. Now you've got your 4 walls, but what if it snows? What idea? This starts with gathering community members and talking about how you can and do support kids in your community. And to keep your group strong, keep those conversations going. Now that you've built your understanding and a pretty great house, it's up to all of us to make this happen. Help spread the word. Raise awareness for the importance of healthy schools by talking to community members about what you've learned and engage them in working towards and growing healthy schools in your community. You're not alone. OFIA and many other organizations are here to help, offering resources and services that will support you in taking action. And taking action only leads to success. Remember, healthy schools healthy communities.
So, I started off by saying that OFIA is really all about supporting healthy schools and healthy communities. We're concerned, as most of us are, about the health and well-being of our kids. And one thing that we've learned through our work, it's coming back now. One thing we've learned through our work supporting healthy school communities is that we all share the responsibilities of health and well-being of kids. And really the underlying strength of the Healthy Schools approach is that everyone comes together. The whole school community needs to be involved. As it says in that video, it's not a one-man show. We all share that responsibility. We all have the ability to share. So that's probably one of the most important learnings that Althea has come across in our work. We did what was called the Living School Initiative from 2004 to 2008 in 35 school communities, where we found that really this comprehensive collaborative approach really does work. From 2010 to 2014, right now we're just winding down a provincial partnership called the Partnership for Healthy Kids, and that is it's in 7 communities representing 13 school boards, 7 public health units, 7 recreation departments, and a lot of other community partners. And the goal is really to support healthy activity for children and youth. And it also involved a partnership at the provincial level that included Health Nexus, People for Education, Parks and Recreation Ontario, and OFIA. So again, we learned more about collaborative approaches and partnerships at the provincial level for this project as well. And we're just starting a new one called OFIA's Smoke-Free Ontario Pilot School Pilot Program, and it's a school-based, youth-led initiative. And this has been a real eye-opener because instead of just, we always say bring youth to the table, but it's really about having them lead the initiatives. So how many of you are familiar with the Foundations for Healthy School, this document here? Okay, you may be aware that there are 4 components in this foundational document, and it's based on international best practice. It's not just something that the province of Ontario came up with. Quality instruction and programs, addressing the physical environment, the social environment, and community partnerships. So that's really the basis of the Healthy Schools approach. But another piece that is really important, no matter what level you're working at, school level, regional, provincial, is the Healthy Schools process. And the Ministry of Education is coming out with a new Foundations for Healthy School. Some of you, have any of you been involved in the review process? Okay, so you've had a look at it. It doesn't look tremendously different, still the same components. It does include a process, which is one that again is recognized internationally, slightly different terminology, but it essentially starts with consult the school community. And that really means bringing everyone together, all key stakeholders. And we always, OFIA has always recommended and suggested, bring students to the table, but honestly, often I don't see them at the table. I have to say, in York Region, I've seen students at the table and they help with the planning. My experience with the Smoke-Free Ontario Pilot Program has led me to really understand the importance and value of having students there right at the beginning. If we want them to help create a healthy school, we need to know what they see as a healthy school and hear their voices. One of the things that youth often say is, don't do anything to us without us. They don't want to be called in afterwards. So bring those key stakeholders to the table, and that's everyone you can think of who might have an interest in the health and well-being of kids and who wouldn't. So bring those organizations and individuals together. The second step is to assess the school community environment. So what's already working well? What are the strengths? What are the assets? Who are the partners, the potential partners? Who else can get involved? What's going on in our physical environment, our social environment, and what's going on in quality instruction and programs, or the teaching and learning. So assess the environment, and then as a group, identify the priorities. What is it you want to work on? You can't do everything at once, so pick an area that you want to focus on, have some success. Success breeds more success, and start working in your own way to move towards that. And then once you've assessed your environment, plan. And really you need a shared vision, so create a shared vision. Plan what you would like to do, create an action plan that's realistic, take those steps towards success. And then as you're implementing your plan, celebrate success along the way, big and small, and evaluate what's going on. So that's really the process. I think I'll leave it at that for now, and we'll move on to the next speaker.
Lori,
Sure.
you want to?
I've got just used slides. Actually, if you don't hear me okay, just like this, I like to be a little less formal if I can, but I don't want to stand in front of Carol and either. So I asked if folks here are familiar from Ottawa, but have folks heard of, if I say Champlain, does that mean anything, or the Champlain CBD Prevention Network? Just a quick show of hands, okay, so maybe just to contextualize. So Champlain is actually referring to our geography. So I'm physically housed at the University of Ottawa Heart Institute, but I am part of a collaboration of partners who have formally come together since about 2006, and the partnership is known as the Champlain Cardiovascular Disease Prevention Network. It's a mouthful, so we call ourselves the CCPN for short, and really we're representative of a number of partners. So we have, obviously myself as a healthcare institution, but we have the 4 regional health units that are within our area, part of our partnership. The Heart and Stroke Foundation has been a prominent partner from the very early days of our work. The Champlain LHIN, the Local Health Integration, is part of our work. So as an entity, this partnership has been around since about 2006, and I think the impetus for it, which there's be some common threads here today, is that there's clearly strength in numbers. If we really want to get serious about prevention, which is the lens that we come from, wanting to really prevent heart disease and really get at the heart, no pun intended, but really wanting to be working in more effective and integrative ways, we must go outside of our individual organizational walls to do that. We have to be looking more effectively at how we can leverage partnerships and relationships to make that happen. And that really was the impetus of us coming together as a region. We wanted our residents to be the most heart healthy and stroke free in the province, and hopefully use that as a system of excellence so that we can share that and extend that to other parts of the province and hopefully more broadly than that. So we went through quite a robust planning process, and where we landed several years back in the early days was a recognition that prevention must include children and youth across a number of settings. And so we started to then bring the education partners around the table for that conversation. And in 2009, we sort of hit a really key milestone, which was the signing of what we called our Champlain Declaration. So 9 school board directors of education and the 4 medical officers of health from the health units in our region, alongside the chair of our network, who's from the Heart Institute, signed this sort of formalized commitment. And what it meant was we were all on the same page. I think Margaret really alluded to that, meeting this common vision. We all agreed that we can be doing more together. We need to come together. So this anchored us, so to speak, in our ability to mobilize as a community. So this is our common vision. It's talking about physical activity, healthy eating, and we're talking about school environments. And I stress the word environments because the idea here is we want to have equity. This is about supporting all kids' ability while in school to adopt the behaviors that we're teaching them. We know what is being taught in the curriculum. Everyone knows what we need to be doing in terms of adopting healthful behaviors. But the link and the key for us, or at least from my view, is that we need to be doing a better job of ensuring that the environments that we create, inclusive of the school environment, makes it easy for these kids and us to adopt those behaviors. So the declaration has sort of anchored us, and then I think, if I just hit the next slide, what we use that to then is what's now called our Healthy Schools 2020 program. So really that's just a matter of we're bringing the declaration to life. So we have this vision, and then what are we actually trying to do to put that vision into practice? So at its core, we're really trying to inspire champions. And I know that sounds a little bit motherhood, particularly in light of the conversation we had this morning about, deliverables and, funding applications that require concrete outcomes in a very short amount of time. But fundamentally in school settings, we know that things happen when there's champions that are willing to get the ball rolling. And we need to inspire more of them. So it shouldn't just be about needing to do healthy foods because PPM 150 says I have to, but we need to want to get people to be involved and be part of the process, and I think that's key. And as I mentioned, we're really talking here about shifting environments. So these are social norm changes. We're looking at shifting culture. It's going to take time, but we must. It doesn't excuse us to start where we can, because these things will take long term, and we often look at tobacco as an example for how that can take time to move. So that's what the Healthy Schools program is about, and how we can do that really is through innovative outreach. And so at its core, in some cases, we've tried to just pull together common tools and resources that all of our health partners can use when we're engaging with schools. We've also been piloting a really exciting facilitation model where we actually have a person who serves to handhold the schools a little bit to walk through the very process that Margaret talked about, which is to say, get into the school, help them identify relevant goals in physical activity and healthy eating, and then help them put that plan into practice by connecting with community partners, looking at ways that they can look at their physical and social environments. So that's an interesting program that we're looking to do more about. And then lastly, I think our greatest strength of this whole process has been, and again, you've heard this before, but this is a smattering of the partners we've brought to the table so far. So we've got education, health, community, and I think the point that for those that were in the session this morning when they talked about sort of partnerships and how to make them really meaningful, I think the lens that we try to take is this philosophy of what can we better do together that we couldn't otherwise do. And what I mean by that is that all of these partners, to some degree, we all have our own organizational mandates. And more often than not, there's at least one common thread, if you will, that all of us share in common. With school board, student success is the same as health, in my view. We're all trying to actually achieve the same things. So in coming together, the niche is not trying to subsume one another's organizational mandates, but rather look at it from the perspective of what can we better do to complement? Are there gaps that we can fill? Or as I mentioned, are there those things that we can better do together that individual organizations wouldn't do? And at least that's been a little bit of the recipe of our success to date. And when we get into some of the questions, I can give you a few more examples tangibly about what we've been doing from a programmatic perspective, but that just gives you a bit of a sense for who we are and what we're about.
Thank you, Lori. Caroline?
Hey, hi everybody. So I'm here on behalf of York Region District School Board. I'm actually here as two different people because, as Sam mentioned, my job in relation to healthy schools, I actually work very closely with a curriculum consultant. So my role is actually based in Human Resource Services at the York Region District School Board. It's a brand new position that was just created this year, so it's an experiment for everybody, including myself and people who hired me. But the way that we've been making some changes to our Healthy Schools approach this year has involved a lot of very close work between myself and Ken Liang, who's our curriculum consultant. And we were both going to try to be here today, but unfortunately he's also doing another workshop and presenting on half of today as well. So we couldn't just be in two places at the same time, so we decided we would divide and conquer. So I will try to answer as many questions as I can in terms of the student side of things, but in reality, my role is more focusing on the staff side of things. And so I'll explain a little bit in terms of how we've actually brought the staff well-being and the student well-being together to be able to talk. Yeah.
Oh, sorry, no. Please keep going. Yeah, sorry. Apologies.
So we've been trying to bring it together so that we can talk a little bit about comprehensive school health. And that video that Margaret showed at the beginning is amazing. We loved it. We really wanted to show something like that. We have Healthy Schools network meetings, and we were looking for a video. And we had 4 network meetings, and I think the very next day, Ken was at a meeting with Margaret, and she unveiled this amazing video, and we were just thrilled to see it, although we could have used it about 2 weeks earlier. So, in terms of healthy schools and workplaces, we really tried to embed this within the culture of York Region District School Board. Is it okay if I step away from the mic? You guys can hear me, right? If you can't hear me, just let me know. Yeah? Okay. The person who's doing translating, I guess, needs to be able to hear me. That's important. So, York Region, we are a very interesting municipality, regional municipality. We're comprised of 9 local municipalities, and we have over 1 million residents. So we are huge, and that puts us in comparison to some of the more urban parts of Ontario. However, we are also a mixture of urban and rural areas. So earlier this morning, I think it was Laura was talking about a project in Georgina, which is part of your region. In Georgina, it's on the edge of Lake Simcoe, and it's completely rural. Like, the community is totally rural, and then on the other hand, we've got the city of Vaughan and the city of Markham, and they're completely built up and urbanized now. So we've got this huge diversity in terms of our rural and urban communities, but we also have huge diversity in terms of our ethnicities and our faiths and all those types of things. So as a school board, we wrestle with all those types of things, and we know that, and I mention that because that also connects to our picture of healthy schools and healthy workplaces, because we know that it's not just about healthy eating and physical activity, although it includes that. It's also about people identifying with their community and a place of belonging, things like that too. So we have over 120,000 students at over 200 schools, and we're always adding new schools. And we have almost 12,000 employees. So it's a complicated environment, to say the least. Earlier today, somebody was talking about, as a health charity, how do we also engage people within the health charity so that we're okay to partner with other health charities, and that was sort of the way that I interpreted that question. It's very similar in the school board because we've got different priorities and different focuses and areas. There's as much networking and collaboration and things that have to happen within the school board as happen with our partners outside the school board. So in terms of the question of whose responsibility is it, it gets even more complicated when you're not just naming an organization or a group of people, but it's who within the organization owns that responsibility, and how do we partner with the other organizations to be able to accomplish that. So as I mentioned, this year we've done some really exciting things. We've moved towards an even more comprehensive picture of school health and well-being. Margaret showed the Foundations for Health in School. That's been a template for us since it was first developed. And it's something that's really helped us to be able to move forward in terms of helping people to think about school health, not just from a programmatic perspective, but also in terms of the environment and the partnerships and all those other pieces together. So what we've done this year is we've taken it a step further, and we've tried to talk to people in the schools about the school environment, as Lauren was mentioning, that it's not just about how do we get our students to be healthier, because we know that we can teach our students to be healthy, but if they see a different message through our role modeling as adults in the building, or they see, that it's not consistent throughout the entire system, that presents a different message as well, and that also gets received by these students. So we know that it's best practice to impact student health, but we also know that it's best practice that if you don't do a comprehensive picture and things only apply to certain people in some ways, you're only going to reach certain people in some ways. You're not going to actually get the whole school to be behaving in a healthier way. And those health benefits are not going to impact as much as they could if it was a collaborative whole school approach. So to do that, we've been engaging our students, of course, our staff in all new ways, that we're talking to them not just about their role as a staff person as it pertains to the students in their classrooms, but we're talking to all staff in the school, so the teachers, the principals, the secretaries, the caretakers, the landscape people, everybody who's involved in that school community, because they are also in the school community, and it's not just a school as a place of learning for students, it's a place of learning for staff, it's a place of work for the staff. There's different functions that the school provides, and also after hours, the school is a community hub. And especially in our rural communities where they may not have huge complex community centers and things like that, those schools oftentimes will double up as a community hub, for people. So we've tried to draw in our municipal partners and other people as well, so we can talk about that school community. We've been trying to also, as I mentioned, involve our internal stakeholders. And so we've had a healthy schools and workplaces policy for about 5 years now. We're one of the first boards, I believe, to develop a healthy schools policy. And what we are now doing is revising that and adding a whole number of new procedures to really strengthen and add some meat to that procedure, to that policy and procedures. And the reason we're doing that is because we want to make an even stronger connection to the Ministry of Education's Foundation for a Healthy School. And we want to make sure that it's tied to our board priorities, and well-being is one of our board priorities, along with equity in the environment and caring safe environments and all those other things that are part of the priorities that help us to achieve student achievement and well-being, which is our purpose of the school board. So we've made our language in the school board setting for our policies and our procedures line up as closely as we can with our Ministry of Education, Foundations for a Healthy School, as well as we've talked to our community partners. So we've had conversations with public health and with local municipalities, because we know that the public health, for example, has a mandate to reach students. They do that through our school, so they have a mandate to reach our student population. We need to be able to talk about their mandate and how that's worded and how our policies are worded so that we can actually open doors for partnerships. So we've tried to, wherever possible, make those linkages, and it's been an interesting journey, I have to admit, and we're still on this journey, but that's the direction that we're trying to go in. To do that, we've revised our Healthy Schools and Workplaces Action Plan, and we've involved a whole number of people in this action plan, and I think there were copies that we made available as well for you, and they're also going to be available afterwards if you're interested in seeing what our action plan template looks like. It's a complicated thing, so we put it together with a toolkit so that we can try to educate our student body and our staff and how you actually develop a comprehensive action plan. So we put together all these different components, a tip sheet in terms of how to walk through it, the template itself. We've given them a sample of a completed one, because what we did with it is that in the past, when people compiled a Healthy Schools action plan, they came up with student-related goals, and they would think of, well, our students are really interested in using our gym for different types of physical activities through the day. So that's great, that's an amazing goal, but what we wanted them to do is not just think about that as a program. We wanted them to start identifying, okay, so you want to use the gym, that's your physical environment piece. What are you going to do to actually make sure that the environment is appropriate for the types of activities? So that might be what type of other equipment do you need, or how do you need to book or age appropriate and all that type of stuff. We needed to make sure that they were, if there were community partnerships they could bring in to enhance that. So it might be, in community partnerships, we've tried to broaden that understanding so that it may be senior students helping junior students to be able to play games and things like that. It might be bringing in municipal parks and recs to be able to run programs with students. There's all sorts of ways that we've tried to do that. Our quality instruction and programs, we've actually brought in to be quality instruction, professional development and programs, because for some reason adults, especially in the school board, tend to think that instruction happens after you grow up. But if you call it professional development, all of a sudden people remember that as an adult, I'm still learning as well. So we've been able to, through that, if you're doing programs in the gym, bring in programs that are age appropriate for our adults as well, so that they can do different types of aerobics or activities that if they don't want to do with the students, they can have a separate time. But even better, what we've seen happen is that if the students or the staff rather are bringing in a Zumba instructor for a 6-week series, they may pay for that instructor for 6 weeks, and then they open up a $5 drop-in for students. So the students are actually joining in those programs as well, and that's all entirely dependent on the schools choosing how they want to run their program. And then, of course, the support of social environment, which is another one of those foundations. We've made sure that they try to create that infrastructure of support for everybody to participate, so that it involves the equity value and priority, so that it addresses the anti-bullying piece, so that it makes sure that even for our staff, that it's not just the teachers that are involved, but the office staff are invited to participate as well. Or for the students, that it's not just the elite students that participate, but it's open to everybody. So in a really quick glance, this is what our action plan looks like now. On the front page, what we've done here is we've, in addition to the contact information, things like that, this section here, the preparation checklist, is how we've tried to reinforce the messaging that, similar to what we've already heard, we can't just go into a school and start running a program. We could, I guess, but it won't be as effective. What we've tried to encourage people to do is think about, have you done needs assessments? Have you done, and we've explained it to the schools that, even a simple survey about what kinds of things people are interested in will make a big difference in terms of how you actually run your program. We've made that connection directly to our board policy, and a lot of people in the schools don't even, they may not even have known or may not have read the policy or be familiar with the language, but that helps them to understand that there is support from the school board, from the upper level, in terms of the programs that they'd like to run, and it is a board priority, so there is a direct line of responsibility from the board to the individual schools. And that third one there, that is incorporated in the school or department improvement plan. Every school in the board is required to have a school improvement plan, and there's a requirement to have a wellness goal in that plan. And so this makes a direct tie to other parts of the board infrastructure, and we've made those connections as much as we can to reinforce this. This is the foundations for a healthy school. I know it looks very different from the green sheet that probably people are familiar with and that Marvin showed earlier. The reason we did this is because what we were finding with the chart form is that a lot of people would fill in maybe the first and the third column or the first and the fourth column, but not all of the columns. And so we did it as a circle so that it depicts a picture of the whole school health. So that if you only filled out 3/4 of the circle, your circle's incomplete. And so it's a visual way that we've tried to prompt people to do this. The action plan theme box at the top there, what we did there is we actually made it a drop down and we listed all the topics that are priority topics according to the Ministry of Education. So in there we've got things like healthy eating and physical activity and mental health and care and safe environments and all these other things. And those topics we again aligned with our public health as much as we could so that under the entire public health standards, the language that they use there is something that we've made relevant ties with our language here so that it prompts people to think about their comprehensive goals. And as you can see, we've also put in student activities and staff activities in each quadrant of the circle. So that again, it encourages people to come up with comprehensive goals. And then from there, they've got other worksheets that they can fill out the details of all the different responsibilities that will help them to achieve the activities that they listed on the circle. This is another planning tool that we've given them to, again, help them think about comprehensive. So regardless of whatever activity they may want to do, it may be just a one-off activity, put the activity in the center of that diagram, and then think about how you would plan that activity comprehensively according to those 4 foundations. And what we've seen through this, just to give you a quick example of how it's transformed our schools, they're now thinking in a much bigger picture, and it's going to take time, and it's going to be a process, it's a journey that we're on. But to give you an example, last year with our Healthy Schools goals, for our Healthy Schools action plans that were submitted, our elementary schools were at about, I would say just under, I think we had 80-something elementary schools recommended action plans. And of those 80-something, most of them were student goals, and almost all of them were student-only goals. And this year when we got it in, we had about 80% of them had staff goals embedded throughout all of that. And they were doing things with the whole school, which we were encouraging them to do. So if they were going to do physical activity, it wasn't just students in the courtyard and staff lined up around the outside watching them. It was students doing the activity and staff intermixed with them also doing the activity. And what our students are telling us is that that is making a huge difference for them. The kids that are intimidated don't want to play tag because they're not the fastest and that type of thing. If Ms. Brown gets on the playground as well and she says, well, I'm it, I'm coming after you, every kid plays. And it doesn't matter anymore because Ms. Brown's playing. So that's the difference that we're seeing, and we're seeing a whole lot more engagement. It's been really exciting. So thanks.
Thank you. Scott?
I didn't make slides, I just want to cut. I'm Scott, I'm the principal investigator on this AHR-funded COMPASS study. And so what COMPASS is basically, it's a hierarchical longitudinal cohort study, and the purpose is to evaluate how changes in school-based programs, policies, and built environment resources over time had an impact on student behavior. The way we're doing this, so we started last year, we're collecting data from 80 secondary schools, 70 of them in Ontario, 10 in Alberta. I'll explain why later if I remember why we're doing. And the 50,000 kids that attend those schools, we're following them for 4 years, so we're just starting the second year's data collection. It's a longitudinal study, so we're actually tracking individual students over time, and it's also longitudinal at the school level, we're following the same schools over time. At the student level, we're measuring multiple risk behaviors among kids. We're looking at obesity, physical activity, healthy eating. We're looking at sedentary behavior. We're looking at tobacco use, alcohol use, drug use. We're also looking at academic achievement, bullying in school, connectedness. So we're measuring those behaviors among students over time so we can see as students progress through school, how do those behaviors develop, and if programs or policies are implemented, how do they actually have an impact on changing those behaviors. At the school level, we're measuring for each of those behavioral domains, the program and policy environment within that school. So based on the Foundations for a Healthy School, we're measuring, for example, for tobacco, what programs or policies are in place, what's in your curriculum related to tobacco, and we can measure over time how those things change within a school. So we can see if any programs or policies change, what impact does that actually have on student behavior, and finally start generating evidence of what works and what doesn't. Aside from the programs and policies, we're also measuring the built environment within each school. So we use our version of the ENDORSE and the SPEEDY study of protocols. For our survey members when they're going around school collecting the student level data, we also have handheld devices, so BlackBerry or Apple iPhones or whatever the data collectors have. We developed an application where they go around the school and do a built environment audit of what resources are in the school related to physical activity or anything related to diet. So what's in the cafeteria? Do they have cafeteria? Do they have vending machines? And the reason we developed this for handheld devices is we can measure over time what changes within it. So each year when we come across something in the school, we can actually take a picture of it and then archive that so we know exactly what's in the cafeteria, exactly what's in vending machines, exactly what the gym facilities look like inside or outside, or other rooms that may not be on these audits that people typically use. For example, some of the schools have yoga rooms, so we can take a picture of it, audit it, and save it for future reference. So we're measuring that over time to see how the built environment within a school, if it changes, what impact does that have on kids. And then for each of the 80 schools, we also map on the built environment to the community surrounding the school. So for each of the schools within 1 kilometer radius, we know exactly where and what type of tobacco retailers there are, alcohol retailers, fast food restaurants, grocery stores, convenience stores, variety stores, things like that. So we can see the community built environment change over time, what impact does that actually have on kids within the school. Where that gets really interesting is we can also start to evaluate, does a particular program or policy work? Yes or no, no one's really able to answer that robustly based on what's been done historically. But we can also start to evaluate, does it work better or does it not work given what type of community environment it's implemented. So if you do it within school, say the food program, does it actually work, yes or no? If it didn't work, did it not work because of the type of community environment it's situated? So that's all the data we're collecting. As researchers, we love data, so we're collecting all the data from all these kids and from the schools over time. And we take that information and we actually feed it back to each school. So this little feedback report, it's a very simple thing. What we do is every year when we've collected the student level data from all the kids in the school, we give this back to the senior administration and say, here's what's going on in the school environment with your student population. Here's how many are smoking, here's how many are overweight, here's how many are, et cetera, et cetera, et cetera. So they know exactly what's going on with their student population. Because we're doing this over time, we have to say to them whether things got worse compared to the previous year, or things are getting better compared to the previous year. We compare it to the national and provincial norm, or to the guidelines that exist. So we can say, here's how many of the kids in your school are actually meeting getting 4 food groups, so we can see how they compare to these guidelines. For each of the behavioral domains, we link them to evidence-based curriculum or program or policies from the research literature to say here's something you may want to consider implementing in your school if it's appropriate, if there's evidence that it works. We also link them to the public health contact for the public health team serving that school that's responsible for that behavioral domain. So each school knows here's the person they need to talk to in public health if they want to do something around this activity. We also link them to a knowledge broker. So we have study staff who are hired. When schools get this report that says, here's what's going on with your student population and what you should be doing about it, the knowledge broker then touches base with each school and says, is there anything you're interested in actually doing, and how can we help you implement that? So they work with the schools to help them strategize on what they want to do. Some schools don't want to do anything. But for the schools that do want to do something, how do we make that, enable that to happen? And another way we do that is each school that participates, we also give them an honorarium or a cash stipend for whatever they want. Most of them use it for programming within their school. So at a high level, that's what we're doing in Compass. The nice thing for this, because it's funded by the federal government, it doesn't cost schools anything. They actually pay money by participating. All of the data we collect from schools in Compass, we make available to any school health researchers in Canada who are interested in using it to answer questions. We anonymize it at the student and school level, so they don't know what schools their students are from, unless you're under 14. So that more people can be using this resource. This is the first time internationally where anything's ever been collected like this. There's a group of people, actually researchers from across North America, who are the one who has the data with it. It's the first time we can actually generate robust real-world data on what programs or policies actually work within schools. And it's not us being researchers top-down saying, do this program, do this program. If schools are doing something innovative that they design and they want to implement, so for example, we have some schools that are implementing a policy banning energy drinks on their school campus. We're actually in the process of evaluating that to generate the first evidence of whether or not those types of programs or policies work reducing energy drinks in schools, for example. So it's not a top-down approach, it's we developed a data system that allows us to answer robustly real-world questions about programming and policies. So I'm going to end there. I can talk for about 2 hours.
Thank you very much. Yeah. Yeah, thanks a lot. If I may, just one of the purposes of this session is takeaway. What can you take from what has been discussed today? So I just elaborate. I highlight a couple of ideas. Maybe it sounds different. I think from Sophia's point of view and Morgan, I could see that she mentioned the youth-led initiative. Don't do things for me with. It's not working. Yeah. So.
Sam, I think there's a hands free.
It's not working.
Oh, that one is.
We tried, yeah. And this is reason. That's anyway, can you hear me now? Can you hear me? I just want to highlight one at least key message for a speaker, I'm not sure with that. So what Margaret said, and I think it's because with me is, if you want to design for school students, let them be at the table. It's a youth-led initiative. Don't do things for me without me. It's really resonates, and I think it's lacking. We do things, always our youth choose the receivers and never at the driver's seat. I think giving them the chance to become a driver's seat, you can make a difference in what they have done. What we don't emphasize in the school environment as a conducive to changing behavior. I think if no matter how you preach, if you don't create an environment that really support what you preach, you're not walking the park, and things will not be ready. From Carolyn's point, I think I like the idea of aligning of priorities between the school board, Ministry of Education, and organization, youth organization partners. Not align because everybody will have an interest to be part of it because there's something for me at the table. And from Scott, I like the comprehensive approach. It's tailored for school and also compared at the national board. At the same time, it's also linking every school to resourcing that really can make an impact if they decide to do something about it. Not only get the information, but also if there's an idea. And I think the one is not approach. It's what's been generated at the school level. Let them see what they're doing, how they're doing it, and then decide what the next steps based on that. I think it's a very innovative way of addressing it. Media goes what we have asked our researchers. But I think let's start with if you have any questions based on what we have listened. And I got Richard's question at the beginning. If we would like to address that in a general thing. I think what you asked is the school has, whose responsibility is that what and I'll give a chance for our parents if someone would like to ask those questions. I think we have got different messages, but there's a certain agency, but it's a comprehensive collective kind of responsibility. Anyone who would like to go and ask, please come.
I can jump in just to get it rolling. I mean, I think the experience maybe that we've had, given that there were so many partners around the table, I think someone has to be the aggregator. Someone has to be the one to get the ball rolling. And I think, again, because we had an established infrastructure in our region that was looking at not just kids, but prevention in general, it seemed to be a very natural fit. But what I found interesting, that one of the first takeaways for me is when we first brought the education school boards together with the health unit partners, we heard the school board say, tell us what you want us to do. Because often, they know that they need to sort of incorporate quote unquote health. But our educators are exceptionally busy. They have multiple priorities, equity, environment, whatever. So it was how do we make it easier for them to do that? So I think the step was they told us, tell us what you want us to do. And so we said we're going to prioritize physical activity, healthy eating, but then we tailored it right even more specific to that. And we came to consensus as a region on the things we would work on. And we started very tangibly. We're going to look at food contracts in our cafeterias. We're going to look at fundraising, and we're going to look at rewards. How are we rewarding our kids? And all of the work that we did was driving home those pillars just to get some momentum going. But fundamentally, you need a facilitator. You need one organization or person or coordinator to get the ball rolling and sort of act as that catalyst, I would say.
When it comes to whose responsibility is, I don't think we've talked about parents yet. And one of the things that we've learned through the Partnership for Healthy Kids is how critical it is to get parents involved. And there are school councils at every school, parent involvement committees. If I use an example from the Partnership for Healthy Kids, as I mentioned, that's a provincial partnership, but supporting regional or local partnerships. And we encourage those partnerships to embrace education, health, parenting, and recreation, and other partners. But we really wanted those partners at the table. And in Ottawa, for example, we were working with Ottawa, the Catholic District School Board, and they made the connection with the chair of the board-wide Parent Involvement Committee and brought her in on their planning committee. And it really made a difference because all of a sudden, these folks were sharing their ideas and, developing relationships where they could say, the chair of the Parent Involvement Committee would say, we've got this big event with all the parents in the community invited. Why don't you come in and talk about healthy schools? And more than that, talk about what resources are available through recreation that can enhance the health and well-being of kids. So and then they also set up something on the website that informed parents about healthy school initiatives and what they could do about health. And the resources that are available, especially through public health, they have so many amazing resources to share, but parents aren't always aware that they're out there. So I would say a critical piece, as well as the having youth at the table, is to involve parents in that. And the more you can get, more of those folks you can get to the table right at the beginning. And I'm going to glance over at Andrea, because Andrea Bodkin was involved. We facilitated a lot of these meetings, and that brings me to another point. It's often nice to have an outside facilitator who's not so emotionally involved and who can stand back a bit and help to bring those people together more. When we did that, we found that, we encouraged everybody to get everyone at the table at the first time, but sometimes everybody was just so anxious to get going. Well, let's have our meeting, and all of a sudden the recreation person can't be there and someone else can't be there. It's hard to play catch up after. So ideally, bring together all those stakeholders, anyone who you think might have an interest. Just say, we're going to be talking about health and well-being of kids through a healthy schools and communities approach. Who wants to come? Yeah. Do you have a question?
Can I
Actually,
answer this one?
sorry.
Can you move to this?
Me?
Yeah.
Oh, yeah. I probably don't need one, I'm very
We're
loud.
doing live. You want to follow up, Scott?
Well, just while she's getting to from our approach, the key stakeholder would be the principal, because from a researcher standpoint, they're the gatekeeper to the school. You can't get them to collectively with it. But from a program and policy perspective, they're also the people that pull the levers to make it happen, and they'd be doing the principals on board.
One of the, I understand the reality of the way things are, that generally there's leaders, principals, coordinators, facilitators. The problem of community engagement is if you have someone taking ownership of an initiative, other people tend to stay back. And then how do you really activate the full potential of community engagement? That's really the question, or I think the dilemma facing us in terms of moving, any agenda forward.
I think data helps drive that, though. I think, I mean, the word that comes to my mind is, is relevant partnerships. And so I think, Scott's example of how, the data is helping to drive that. It drives also Carolyn's example of, she used the term needs assessment. I think what we're trying to do is then help them plan relevant goals based on their existing school environment, school culture. And the partnerships will be different for each school. Each school is its own culture. They're also geographically situated in areas that might have, for example, a local Y down the street, or might have a mom and pop pizza shop that's interested in perhaps being their catered provider, but needs to know how to make those offerings helpful. So it all depends on context. And partnerships becomes an issue of relevance depending on where they are. And I think what we're all sort of saying is there needs to be some body to help catalyze and lead that, whether it's the knowledge broker that Scott talked about, Margaret talked about facilitators, we use facilitators as well, Carolyn, it's all about giving that extra boost. That's sort of how I see it, but it becomes an issue of context, I would say.
Did we answer your question?
Yes, thank you very much.
Mario, you presented a couple of questions, so one thing I would like to ask you, what challenges or barriers have you encountered and how they were addressed? In your 18 years experience, if you can give them the kind of barrier that you most common things you encountered, how do you
I guess bottom line is partnerships take time, and creating a healthy school environment takes time. And so, I mean, you brought up a good question when you asked who owns it, and Scott mentioned we need to get principals buy-in right away. It can be a challenge to do that because schools are such busy places. I mean, we're all busy in our lives, but I've just come to realize that even more so this year as I approach school communities to see if they want to be involved in our school-based tobacco prevention program. And everyone's going, oh, it sounds wonderful, but oh, we just can't, we're just overwhelmed. So I would say keep reminding folks that it's all about the health and well-being of kids and make those links between student success and achievement and health and well-being. So it's part of what Carolyn was talking about, sharing the language, because we all speak different languages when it comes to the way we work and our mandates. So for example, through the Partnership for Healthy Kids, we encourage communities to engage with their recreation departments. Recreation, well, from what I've been learning anyway, is sometimes the term healthy schools excludes them. They think, well, okay, that's all about the school, what do I have to do with that? So we need to share that healthy schools really is about creating a healthy school in community, because we don't want it to be just a school. We need those partners engaged. I remember in York Region at one of the network meetings, Recreation was a partner, and they were wonderful. They invited the networks to use the space at the Recreation Department for the meeting. And then I remember stepping outside into the hall with the Recreation leader afterwards, and she walked over, and we passed the vending machines where they were selling hot dogs from the vending machines. And she went, oh my goodness, we've got a lot of work to do. So it's about going beyond the school and extending out to the community. So I guess one of the biggest challenges is recognizing that it takes time, that we do speak in a different way, and that we need to find, I really resonated with me what you're saying about the need to sort of align everyone's mandates with that bottom line goal of we're all here for the health and well-being of our kids.
Anybody want to address the barrier and how we came about it? Is that a balance?
Oh, okay, yeah, this might be a controversial one, but
Go for it, Scott.
as a researcher, our biggest barrier is school boards. Yeah, a lot of it, I'm saying, it makes sense that they're gatekeepers. But the challenges associated with some of the ethics protocols in the school boards aren't necessarily aligned with doing research to improve the health of kids. And some of the biggest school boards in the province have ethical procedures that I think are quite unethical. Even though there's a lot of research to back that. The other biggest barrier are fellow researchers who do school health research. So lots of schools and lots of school boards are burdened with a lot of people trying to collect data from them. And one of the things we tried to do with Compass, we knew of 3 other large surveys that were happening at the same time as us: the Health Behavior School Children Survey, the OSDA Survey, and the YSS Survey. We asked them purposefully, what is your sampling procedure? What schools and school boards are you sampling? And we avoided sampling schools that those surveys were trying to approach to not burden the schools. What's interesting is if quid pro quo doesn't work the other way around. We have a lot of research groups trying to work collaboratively. If you looked at the 10 biggest data collection groups from schools in the province, almost all of us are running the same data. And there's only 2% who are willing to share data with the other researchers. And so the biggest, trying to get researchers to actually work together instead of having them at all without who's wanting to control the data, I think is
Maybe even just to build, it's actually your point, Carolyn, in terms of how to make this a priority. At least the advice we were given is these SIP plans or school improvement plans or board improvement plans. I think getting at those key accountability documents, so where are schools and school boards most accountable, those are sort of the core essence, I guess, of what they're going to do. And if there's a way to ensure that health becomes prioritized in those key domains, I think that there's a greater chance of getting that momentum going. I hope you'd agree with that, Karen.
I don't need to say anything because people keep saying my points. But yeah, no, definitely, and like even as a school board, I would say I agree even with Scott in terms of, like, sometimes the board itself can be its own barrier, because boards are designed to be legislative type places, like, they set rules and they set ways, processes for things to be done. And I would just have to say that, like, a lot of the time it's an issue of patience and an issue of persistence and learning how to navigate that system the best way possible, because there will, at the bottom line, be a priority for the student and staff well-being and achievement. In our board, we just call it student staff well-being and achievement, and everything lines up to that, and equity influences that, eco influences that, healthy schools and workplace influences that. And so for us, we were able to draw that line very easily, but in every school board, in every community situation, it's kind of like what we've been talking about all day today, that at the bottom line, it's very difficult to say, I don't believe in healthy kids. So it's a matter of figuring out what the language of that context is and figuring out where the strengths are and how to align that and how to bring those things together, because even though I'm a wellness advisor within our board, I have to, like, part of the reason why I work so closely with our curriculum consultant is that I'm from HR. My role is not in curriculum. I'm not familiar with the curriculum stuff the way that the curriculum consultant would be. And my role is not to influence curriculum, that's the role of the people who are on that side of things. So what we do is we partner together and we talk about how can we bring the staff well-being and the HR stuff together with the curriculum consultant stuff. And how can we align those things? And same thing with public health in terms of their mandates through a totally different ministry. We know that the ministries, it's great to hear that the ministries are starting to talk to each other a little more. But we know that historically and practically speaking, that's a challenging thing to do, and so it's going to take time. And so it's a matter of patience, a lot of patience and persistence, and learning how to navigate and sometimes circumvent ways to be able to get to your ultimate goal. Because at the bottom line, people do agree. It's just a matter of we need to make it fit within the systems that we've got.
So I'll give you a chance to ask you a question.
All right. I was probably trying to do it at the wrong time. I'm from Hamilton, so I'm not sure if my question pertains more to Hamilton or other communities. And it's really a question, I guess, around research and policy. And that is that we are confronted with school closures. So what's happening is that in our most challenged neighborhoods in the city, basically we have schools that are sitting empty. And I think this has a huge impact, not only on the health of students, but on their families and on the neighborhood as a whole. So instead of walking together to school, kids are being bused for 30 minutes to go to a school that is outside of their neighborhood. And again, I think it has a mental health effect. So there are policies that are being set at a guessing provincial and federal level that are having this huge impact on the ground within the schools in a city. So I was interested in whether or not there had been research, I guess, done in this area and whether others are being confronted with the same issue.
My district, there's probably no research on the impact it has. If you look at most of these things, there's not a lot of actually robust research available. We're trying to answer that with two of the schools in Compass that were based on example. One of the schools is closing, so two schools are merging. And we're actually evaluating what impact does that have on the kids within those schools. So when kids transfer from one school to another school. This goes to my point, one of my questions of why it's important to have longitudinal data. Because now we can actually say what happens to kids when they go from two schools into one school in terms of the profile of the kids, but also in terms of their education outcomes, bullying outcomes, things like that. Because part of the problem is in the province of Ontario, there's almost no longitudinal data collected from kids. Almost everything is cross-sectional or repeat cross-sectional. No set of data available that can answer those questions. So one of the reasons why some of these decisions like closing schools may be made is there's actually no evidence to tell people in the Ministry of Education that this is a bad thing to do. In my experience consulting with the Ministry of Education and the Ministry of Health, it's one of the reasons why they make certain decisions sometimes is because there's actually no evidence to say not to do it. So one of the reasons why it's important, I think, that have these ongoing data answering a lot of questions is to be able to actually generate some evidence so we have proof of what decisions make sense and don't make sense. Because right now, even though there's a lot of people researching youth health, there's not a lot of robust evidence on anything.
I'm really excited about all the research that's going on. I wanted to know if any of your research also looks in or takes into consideration through a gendered lens. I'm on a lot of community committees and even looking at within our own community of access to affordable recreation. Those questions aren't even asked. We're making sure that we're having targeted populations have opportunities, but we don't look at it through a gendered lens. And I think that one of the things that I see is in schools, athletic opportunities aren't available at the same rate for girls. Older siblings are under the auspice of taking care of the girls, so after school programs are not available, and then looking at sort of the opportunities for sort of access to affordable. You see a lot of free programs that tend to target young men, or girls are watching or cheering and not participating. So I just wonder if any of your research sort of looks at that when you're looking at sort of equity as well as that being a factor.
You'd be happy to know everything funded by CH right now has to have a gender and equity lens of it. So every question we answer, we explore at a high level what programs or policies work, and then we explore whether it has a differential impact on males versus females. And then we also look at for each school and provide them information on what the gender equity balance is within the school, so they know what they're programming. Aside just from gender, another thing you might want to too is that equity can be looked at from multiple levels. So we also do it with ethnicity, particular ethnic groups, especially with respect to officers of Aboriginals, because we're collecting a lot of data in northern schools where the bulk of the student population, many of the schools is actually Aboriginal kids that face substantially more barriers, especially when the female officers of Aboriginal. So it's something now that at least at the funding level for researchers, you have to have that in your research plan in order to get funded. And we try to share with each school whatever the school-specific results are, but also when we share our data with the public health units or with the ministry using this evidence, they also figure out the gender.
So I can just add, with the school facilitation pilot that we're doing right now, so in the Champlain region, we have 16 English elementary schools that are part of this program, which is generously funded by the Heart and Stroke Foundation. And the evaluation is actually being led with colleagues at the University of Waterloo as well. And so similar to sort of the Compass report that schools in Scott's program would receive, schools in ours also receive a report, and a lot of the data is also showing very tangibly where there might be some gradients or difference among age groups between the grades they assess. They're assessing at student level grades 5, 7, and 8. But if there is any interesting trends or differences between boys and girls, that's also documented. And what we've been seeing so far, the on-the-ground application of that is that data, which was sort of collected at the beginning or just before the start of the program. The facilitator is now going in and has helped schools to document an action plan. That is helping ground their action plan, or at least refine it or revise it in a way that if maybe there were some things that weren't obvious when they first did the planning, the data is obviously helping drive any shift or change, so it becomes very relevant at that point. And maybe to pick up on the comments you made too around, also trying to just move away from some of those traditional sports, recognizing that often it is the girls that are at tween age that are not engaging, and how do we keep them involved is to try to move away from some of those traditional team-based sports and just emphasize movement and different things, yoga, hip-hop, dance, these types of things that are a bit more inclusive and not so determined on traditional team-based approaches.
Yeah, questions here.
I'm just bringing forward a comment from our live streaming participants from la FESFO, la Fédération de la Jeunesse Franco-Ontarienne. And they're really an organization of students who help build bridges between the education, the secondary sector, and the community. And what they've done is they understand about nutrition and health, and so they ban energy drinks at all of their events. And they've also, for secondary students, created a resource called Alimentation, so kind of nutrition action. So that's how they're the voice of the youth, and the youth is aware, and they're sharing that awareness within themselves and helping leverage that within the school system. So they just want to
Thank you for
put that forward.
sharing. Question here.
As a mother, nurse, educator, and health collaborator, I commend the wonderful work that you're doing. I think I have a question from each one of those roles, but I'll keep it short. Although I just have to say, every time I hear about boys being the focus in schools, and I was blessed with 3 boys just to teach me that it's more than just them being boys. So they were never the ones that were sought after to be top of the team, and they come home saying, we didn't do anything today because they weren't the 12 kids that were on the team. So, I really encourage us all to remember that those kids on the team, a friend of mine said, well, just have them go out for something else. My oldest son doesn't take no for an answer. He went out for every team, including the tennis team. I said, Jared, you've never played tennis in your life. You're in grade 9 and you're going to make the tennis team. But I want to be active at school. Of course, he didn't make the team. So, what I wondered, are there actually, and I think I'm going to focus on the York project, I think it sounds fabulous, are there actually policies that you're following? And if there are there ways to ensure that they're being implemented? And I'm going to say, I hear in the research that you can actually take pictures, or you have people that are walking around making sure that what people say they do is actually happening. And again, because when that physical activity, 15 minutes of DPA, daily physical activity, and everybody would say, oh, yes, we're doing it. And then I got a note home that my son had punched someone. I said, what do you mean he punched someone? He said, Mom, it was raining. We had to sit in our desk, and we were told to go like this. And so he did this to his friend and got in trouble for punching. So, things really backfire. So on books, that school was doing 15 minutes of CBA. I don't consider sitting in your desk when you're an active 10-year-old doing this physical activity. So is there a way that you make sure they're doing what they say they're doing? And is it actually policy or is it guidelines?
Great question. So, the simple answer is yes and yes. So we have the Ministry of Education's mandates that they've outlined to us, and so there are certain things that are mandated by government, like the physical activity for grades 1 to 8, for example. However, the way that gets implemented very much so varies across the boards. So what we've done, and what we do have, we've had, as I mentioned, Healthy Schools and Workplaces policy in our board for the last 5 years. That policy was, at the time that it was developed, revolutionary, and it was brand new, and it was leading edge, and all that kind of great stuff. We were one of the first ones to do it, and it was just a really good thing to do, because what that did was it gave us the opportunity to really, in a sense, legitimize Healthy Schools as something tangible within our board infrastructure. The policy language, the way that our policy infrastructure is that we have our policies that state the big picture, thou shalt, and then we've got procedures that determine how thou shalt. So we had a policy and we had one procedure that was related to substance use and abuse, and I believe from the way that it reads to me, I wasn't here at the board at the time that it was written, but my understanding is that it may have been related to some incidents that had occurred, and that's usually when procedures in those organizations tend to be developed. If there's a problem, we need to know how to deal with it, we need something that tells us how to do it. That was our only procedure. So what we've done since then, what we're currently in this process of doing, we started earlier this year, is we have started to write additional procedures. We first of all revised our policy entirely because it didn't include anything about mental health, and it didn't include some of that language that we've now grown into. So we've updated the language so that we can reflect a more comprehensive picture of what health in our schools would include. We've revised our substance use and abuse policy that it also includes a bigger picture in terms of related behaviors related to substance use and misuse.
We changed the language to be updated with the ministry's upcoming new foundations language, as much as what we know so far. We've also started to write a ton more procedures to tie into things like healthy eating, physical activity, and mental health. And we've linked to other procedures that we have. It's a board. It's like procedures and policies for how to walk. That's just the culture of the organization. There's just a lot of stuff in there. And so in a lot of cases, we didn't have to write a new policy or procedure, but what we did have to do is make a link to healthy schools. So for example, there's equity policies and procedures that exist, where there's things about anti-bullying, safe environments, and things like that. That all obviously impacts healthy schools, but they already had done that under different types of priorities. And this is what I said earlier, that it's about understanding the language and making those connections and finding the right avenues to support the things that you want to do. What we've done in our new policy is that if there was a procedure or policy that existed that connected, we've made that connection. And we've explicitly written, for example, board policy number, whatever, will be implemented in support of healthy school workplaces. So that it's an obvious tie so that we can see that cross-reference, and then we then go to the other people who did the other policy and procedure, and we ask them, can you please also put a connection to the healthy schools piece so that we have some intersection and cross-linkage wherever we can. So there is some infrastructure, and we are trying our best to develop and to grow that. In terms of the other part that you asked, in terms of accountability and making sure that those things get done, that's a lot trickier. Really, a lot of it is through the principals and the administrators and superintendents and the people who are responsible for that accountability. But what we've found is that a lot of the time, they also need training and support in terms of how to do that, because they don't only have our healthy schools policy to uphold, they've got a million other things, because that's the type of organization that we have. So that's a big part of what we need to do moving forward with that, is how do we actually support the implementation, how do we ensure accountability. Our Healthy Schools and Workplaces Action Plan is one of the ways that we intend to do that as we develop it, because having that obvious connection between the ministry, our policy language, and also now the action plan, what we can see is from the action plans that get submitted to us, we can see the intent there to align to whatever the policy language is, and we can then follow up with them directly and provide support, because it's not just about accountability, it's also about, if you want to do something about mental health, have you heard about these organizations that are willing to come and bring speakers into your school, or have you heard about this opportunity? So it's that type of relationship that we're trying to develop, and it's an ongoing process, and it's probably going to take some time to iron it all out, but that's a big part of how we are trying to provide that support.
Let's take one last question. I need a 1 minute answer for you. We're almost wrapping time, and I could have some words from Michigan. Go ahead.
Thanks. Well, my question is in relation to school gardens. They are they're on the to-do list of the Foundations for Healthy Schools, but we know that there's actually no dedicated support for school grounds in the Ministry of Education funding formula. That appears to be one of the gaps in terms of implementation. So I guess that's more of a statement than a question. But I think moving forward, I'd be really curious what the panelists think about school gardens as a location, as an intervention for the Healthy Schools framework, and also what research might support that, what research might be undertaken currently that you're aware of, and what research might be important moving forward.
So this year we're collecting the second wave of data with Encompass and the healthy eating recommendations in the school feedback report. One of the recommendations we're making is that schools should consider putting in a vegetable garden for each student, things like that. What we're trying to do is not all schools are going to do it. We know some schools are interested in doing it. With the schools that actually implement it, using all the schools that didn't implement it as part of the controls and longitudinal design, we can actually evaluate and know by next year whether or not they work, whether schools implemented them, why didn't they? And if they did do them, did it actually work? Because if it didn't work, maybe we should be recommending them. If it did work, maybe we should. So we're actually trying to evaluate some evidence.
In all fairness, 1 year may not be a big enough window to make that call, but
there's also 3 more years of data after that. So before people, one of the challenges I find in policy is people get ideas, they implement policy, and then everyone gets on board with it before there's any evidence if it was yes or no. This at least gives us a quick snapshot of, is it having any outcome? And what we may find, it may not have actually anything to do with improving their diet, it may actually do a lot to improve their school connectedness or something, or their academic achievement, which is another reason to keep a program. Because too often when policies are evaluated, people only evaluate it with the lens of the impact on one particular outcome instead of on other.
Thank you, sir. That was 3 minute response, not 3 minute response.
Well, I'm just, if you're looking programmatically speaking, I know there's an agency called Growing Up Organic that also seeks to work with schools to try and foster these community gardens where appropriate. And there's also some instances in some of the schools in our area where new schools that we knew were getting built. There was actually conversations to try and plan for the opportunity to have those grounds put in place. So just some tangible sort of anecdotal things that are happening, but I think we see it as an opportunity to help develop food literacy skills, and we've often also seen it used as an example of in PPM 150, the struggles with revenue, which comes up often in some of the secondary cafeterias, looking more creatively at ways to offset expenses. And in some cases, they've tried to explore whether growing some of the produce that might actually get used in the cafeteria as an opportunity there. So just some anecdotal things of what we hear going on in some of our schools.
Anyone comments on this topic?
Yeah, we actually, at the York Region School Board, what we've got is the gardening piece, and here again, the priorities being divided differently, typically falls under eco. And so they see that a lot of schools and the board sees it as an eco project because it's teaching kids about the environment and cultivation and all that kind of stuff. And what we've done is we've encouraged the schools through their action plans, if they want to do gardening, partner together with your eco committee on your school grounds and do it as a combined thing. We've actually also, at our head office for our board, we had our first community garden for our staff. So that's another really great way to be able to do it, is that it's not, and to introduce the idea that it's not just for the kids. The staff actually are coming to me in our building and telling me about how they love having that space there. It's theirs. It's a mental break away from their office and their desk, and it's gotten a lot of people in the building talking to each other from different departments, and they didn't know each other before. So there's that type of benefit, again, to echo that, it's not just about the healthy eating, but there's all sorts of other benefits and things that we've been able to, I guess, measure anecdotally. We haven't done a formal evaluation on it, but that's something through our action plan that we're going to do.
Just before Elaine, I'd like to end up by asking each panelist to identify one critical factor, what we're doing successful, because sure we'll do forward when we do it for us. 1 or 2 1-minute responses. We have only 2 minutes to end this session, and after this, we'll share this with us.
I think definitely the alignment and the buy-in for every community is going to be different, right? Your strengths are going to align in different places. For us, we're really lucky to have a director who is a very strong proponent of well-being. And so student achievement and well-being is a priority within our board, and we've now brought in that to be student and staff well-being and achievement. And there's a number of different priorities within our board. So our opportunity and a lot of our success has come as a result of years of that lead up and that build up in terms of people recognizing and understanding the well-being and the priority of the board. And also now broadening that so it's not just here's your student activities and here's your staff activities, but bringing that together and talking about comprehensive school health and comprehensive health within all of our offices in our building. So it's that alignment piece definitely, because we can now say that it's not just because we have a team of people or a particular person, even if it's our director, who's supporting this, but it's also now in alignment with the ministry and it's in alignment with our policies as they get developed and things like that too. So.
I think Sam already hit on the key point for me, which is really about supportive environments, and we're talking about making it easy for everyone, staff, teachers, students, to be able to adopt these healthful behaviors. And one thing that we didn't really talk about that I'd like to just leave you with as well is that we really do focus on the behaviors and take the weight of the conversation, particularly physical activity, because we know that it really doesn't actually make a whole lot of difference when we talk about weight. So, but there are reams of other reasons why we should be physically active, and when it comes to healthful eating, skills like
gardening work, reconnecting with what real food is about, learning how to cook. I totally agree with Jamie Oliver that if every school, every child left the school system knowing how to cook 10 meals, I think we're setting them on a path to healthful eating behaviors that will set them on a good course for life. So it's about the healthful behaviors and creating the environments in our school settings which make it easy for all of us to adopt those behaviors.
And I want to emphasize the importance of partnerships. We all share a responsibility for the health and well-being of our kids, but more importantly, we all have something that we can share. So I think it's important to identify those gifts, those assets that we all bring to the table. I also want to mention that OPIA has a new tool that will be out in the next little while, very short period of time. And it was as a result of some of our learnings through the Partnership for Healthy Kids and our other work through the years. We're developing a series of posters, infographic posters, that help people understand the roles of and the mandates of the various sectors and how you can access them and some of the ways that you'll be able to access them. So please check out, I've got these cards with us for you today. So it has OPIA's website on it. If you go on there, you can access our video, share it widely, the Helping Schools video, but also the infographic posters that help people understand how and why you should access the various partners within your school community, and in particular, parents, recreation, public health, and education, and how they can all work together.
In French and English.
I'm going to be predictable and say evidence. A lot of people are doing wonderful things within schools, led by students, led by principals, led by public health units, led by the province. What's missing in almost all of these is evidence of whether or not it works. That's robust enough to be able to implement it somewhere else. So what we're trying to do is we've developed a mechanism to be able to generate evidence to understand what programs or policies work for whom in what context. Because the researcher working in this domain, the evidence is what's lacking in multiple behaviors, even something like tobacco, where it's been studied to death for the last 20 years. There's not evidence of one single school-based program. There's policies that work, but not one single school-based program that actually has an impact on reducing smoking. Even though we know schools are doing lots of wonderful things, there's no evidence to say that it's good. So we want to
I would like to thank our parents that connected with these videos.